I once spent hundreds of hours looking at a film of a family therapy session, and there was a mother and a father and the child who was the identified patient and a psychotherapist. And that child was a bizarre behavior, disruptive, just. And I thought, oh, that child is making his parents miserable. What an awful thing. And then after I'd watched it another 100 times, I thought, you know, it's that mother that's making the child behave that way. Another 100 times, and I thought, and that father's sitting there, you think he's not doing anything. He's the one that's causing all the trouble. And then eventually I thought, you know, I think it might be the psychotherapist. The point being that the pathology was not in the child or the mother or the father or the therapist. It was in the system. It was in the pattern of relationship between them. And I was trying to attach it to an individual, which is the way we are trained to think about causation.
Good morning. I'm Dr. Manveer Bhatia, a senior neurologist and a sleep specialist from Delhi. I'm going to be discussing this important relationship between sleep and anxiety. It's been seen that almost 30 to 40% of patients with anxiety will have sleep issues, and similarly about 40 to 50% of patients with sleep issues can have almost anxiety. So what is it and what are the pointers, or what kind of sleep problems do they have? Patients with anxiety can have a delayed sleep onset. That means difficulty in falling asleep. They also find it difficulty to maintain sleep. Frequently they have awakenings at night, and they also wake up very early in the morning. So thus all kinds of symptoms of insomnia can come up with anxiety. In addition, the day is bad. They have body aches, there's lethargy, there is decreased interest in activities, and there is headaches. What is to be done, or how can one pick these people up? They can present to a sleep specialist. They can also present to a psychologist or a psychiatrist. But they will complain of clammy hands, sweaty hands, feeling of palpitations, heaviness in the chest. So thus, if we have a combination of symptoms of sleep, that is poor sleep, unable to fall asleep, along with symptoms of anxiety, please do think about the coexistence, and we need to work on improving the sleep in patients with anxiety so that symptoms can get better. And similarly, if patients with sleep issues, you need to settle the anxiety for the insomnia to get better. So treatment of both is important to make the person feel a lot better. Hello everyone, I'm Dr. Manveer Bhatia, a senior neurologist and a sleep specialist at Delhi. We're going to discuss this very important relationship between sleep and diabetes. We are all familiar with diabetes. It means that the blood sugar levels are high and your body is not able to regulate them. This could be because of a deficiency of a hormone called as insulin, or a poor action of insulin. So what does sleep have to do with this? We know that if sleep is not good quality due to any reason, if it is broken, disturbed, frequent awakenings because of apnea, snoring, there is a surge of chemicals in the body, which is something like a cortisol, and which people understand is like a steroid effect. This causes rise of blood sugar levels, which occur multiple times during the night. So thus, the blood sugar levels will then gradually remain high and will persistently be high during the day. In addition, there is also, the research has shown that the insulin is quality-wise also doesn't work well. So thus there is an impaired action of insulin along with increase in blood sugar levels, and this can either precipitate a diabetes, which is called as a pre-diabetic condition, or in patients with diabetes it will make their control very poor. Thus, to put it simply, if you need to maintain your blood sugar levels, we would suggest just make sure that one gets. Thus, to ensure that we maintain the blood sugar levels while asleep or day and prevent diabetes, I think it's very, very important to just ensure good quality and quantity of sleep. Good morning. I'm Dr. Manveer Bhatia, a senior neurologist and a sleep specialist from Delhi. Today I'm going to be talking about a very closely related topic, that is sleep and depression. So how are they related? How do they impact each other? And what can we do to help the patients feel better? That's what the main theme is. So first of all, the symptoms between the two are pretty similar. So patients with depression start by saying that they feel tired, they are disinterested, there is lethargy, there is fatigue. And in fact, patients with sleep apnea also often have the same complaints, that they are tired, lethargic, disinterested, and feel like getting into bed the whole day. Patients with depression also feel very sleepy during the day. Patients with sleep apnea also feel very sleepy during the day. Thus, it becomes important to filter out or to identify that is this sleep apnea that we are dealing with or depression. So ask for questions like, are you snoring? Is the snoring very loud and disturbing? You wake up often with a feeling of choking. These are pointers that there could be a coexistent sleep apnea. Secondly, patients who are on treatment for depression, during the course of the treatment, they frequently gain weight, and thus they become predisposed or get a tendency towards developing sleep apnea. So one should ask them during their course of illness that has snoring become louder, is lethargy becoming more. So thus these two conditions are what are called as bidirectional. The sleep apnea can have an impact on depression, and depression can have an impact on sleep apnea. So thus I would say that in patients with depression, the occurrence of symptoms such as snoring, choking should be looked for, and vice versa. In patients with sleep apnea, if treatment is going well, patient begins to feel lethargic, sleepy, tired, disinterested, do think that is there depression creeping in, because we need to treat both to make the patients feel much better.
I can think of the best piece of advice I've been given, but it's nothing to do with acting. Well, actually, it probably is to do with acting, but indirectly. And that was given to me by Howard Sackler, who wrote The Great White Hope. Wonderful American writer. Sadly, fell out of the tree. But he said to me, John, the greatest freedom in life is to know that it is not necessary to be liked. I mean, it's very carefully worded, because it doesn't say the greatest freedom in life is to be disliked. It says the greatest freedom in life is to know that it is not necessary to be liked. I like that.
I'm not a leader.
You're already a leader.
This is your destiny.
I have had the privilege of serving at 3 different higher education institutions. In each one of those, 3 relationships come up right off top of mind. The president, I think it's very important that you need to understand what that person's goals and missions and aspirations are. If you're not doing things in support of that, you're not going to really be successful as a leader in that institution. Then 2 others, I think, that have a lot of responsibility and a lot of purview at the institution are your provost and your chief business officer. So I really try to cultivate relationship with those 3 first and foremost. Then from there, I move to the next echelon, I would say, and that'd be the rest of the cabinet members at the institution, other VPs and other deans, because they have a sphere of influence as a programmatic leader, right? Then after that, trying to seek out those informal leaders, and there are many of them around the institution, predominantly in the faculty or other ranks in the staff, and find out what's going on there. So there's actually the formal leadership of relationships I want to cultivate, and then those informal leaders that they don't have the titles that would say that they're leaders, but people gravitate to them and they're what they're saying and what they want to do. So it's important for me to connect with those folks as well.